All right, hello everyone. Welcome to Biomonitoring California's virtual meeting of the Scientific Guidance Panel. Today's meeting is being held via GoToWebinar platform only and is being recorded and transcribed. All attendees are automatically muted when joining the webinar. There will be several options for providing comment during the meeting, which are currently being displayed on the screen and which our Chair Meg Swarsman will also be explaining a bit later. If you will be speaking during the meeting, please use a headset if possible. Remember to speak directly into your microphone and introduce yourself before speaking. This is for the benefit of the transcriber and everyone else on the webinar. Meeting materials are available to download from our website at www.biomonitoring.ca.gov on the March SGP meeting page. If you're having technical difficulties during the webinar, please send an email to biomonitoring@oeha.ca.gov, which is also on the screen, and we will have someone from our IT department assist you. We will be breaking at 12:15 p.m. for lunch and also take a 15-minute break just after 2:30. And we will begin the meeting promptly at 10 a.m. So hang tight until then. Hello. Hello.
Hi, good morning.
Good morning. Good morning, Jose.
Hello, everyone. Hi. For guest speakers, we're going to start in a minute. If you're not, until you're speaking, you can keep your webcam off and your mic muted. Panel members can either keep their webcams on or paused. Oh, Nerissa as well. You can turn off your webcam for now.
Alrighty. All right, it is just before 10 o'clock. So I'm going to go ahead and introduce Vince Cogliano, who is the Deputy Director for Scientific Programs of the Office of Environmental Health Hazard Assessment, OEHA. Vince is stepping in to give the welcome on behalf of Lauren Zeiss, OEHA's Director, who will be joining the meeting a bit later. So I will go ahead and hand it over to you, Vince.
Thank you very much, Stephanie. Good morning, everybody. I'd like to welcome the panel and audience to the meeting of the Scientific Guidance Panel for the California Environmental Contaminant Biomonitoring Program, also known as Biomonitoring California. Thank you all for participating and for sharing your expertise. The Scientific Guidance Panel last met on November 8th, 2020. We started with an update on the biomonitoring study currently under development to evaluate the effectiveness of air filtration in reducing air pollutant exposure in an AB 617 community. Input from the panel and audience included highlighting the importance of including a control group to better interpret the results of the intervention, controlling for tobacco smoke exposures and analyzing results for certain chemicals such as polycyclic aromatic hydrocarbons, ensuring that we understand and are transparent about the capability of the air filtration system being evaluated, including whether it can reduce levels of SARS-CoV-2, that is the virus that causes COVID-19. The remainder of the meeting focused on discussing challenges in biomonitoring surveillance studies, informed by a series of guest speaker presentations. The main goal of the discussion was to identify surveillance priorities for Biomonitoring California. Input from panel members included highlighting the importance of tracking temporal trends in chemical exposures, while noting that this is difficult given program resources. Encouraging the program to partner with biobanks and other groups to obtain already collected biospecimens for analysis, and suggesting the possibility of measuring chemicals in wastewater to complement biomonitoring. A summary of input from the November meeting, along with the complete transcript, is posted on the November SGP meeting page at biomonitoring.ca.gov. Because we're meeting virtually today, I would like to have the SGP members introduce themselves and also your affiliation. I'll be going through the list of SGP members alphabetically, so I'm going to start with Dr. Craner. Please unmute yourself and tell us your name and your affiliation.
Carl Craner from the University of California, Riverside, Distinguished Professor of Philosophy and a faculty member in Environmental Toxicology.
Thank you. Dr. Fien.
I'm Professor Oliver Fien at the UC Davis Genome Center. I'm an analytical chemist and toxicologist.
Thank you. Dr. Ho.
Hi, I'm Una Ho. I'm a professor of environmental health in School of Public Health in San Diego State University.
Thank you. Dr. McCone.
Hello, I'm Tom McCone, Professor Emeritus at the University of California, Berkeley School of Public Health, also a retired affiliate at the Lawrence Berkeley National Laboratory.
Dr. Quintana.
Hi, hope you can hear me.
Yes, we
I'm
can.
a professor of public health at San Diego State University.
Thank you. Dr. Singla.
Hello, good morning. Veena Singla, Senior Scientist with the Natural Resources Defense Council in the Healthy People Thriving Communities program.
Thank you. Dr. Suarez.
I'm Jose Suarez, Associate Professor in the School of Public Health at the University of California, San Diego.
Thank you. And our chair, Dr. Schwarzman.
Good morning. Thanks, Vince. I'm Meg Schwarzman. I'm in the Environmental Health Sciences Division at the School of Public Health at UC Berkeley. And if we've had all of the panel members introduce themselves.
Yes, we have. So now it's time for me to hand it off to you to chair the meeting. Thank you very much.
Great. Thanks so much, Vince. Right here at the outset, I just have ex parte contact to disclose. In September 2020, I was contacted by phone by Mr. Greg Herner of Carpenter Severs, requesting a meeting to discuss evidence on quaternary ammonium compounds, the subject of today's meeting, which we will refer to as QACs. And I just directed him to submit materials or comments through the program staff. So I want to review the goals of the meeting for the panel today. In the morning session, we will, as usual, receive a program update, and we'll then review possible options for statewide surveillance, which was what we discussed at the November 2020 SGP meeting, and staff has since developed further ideas based on that discussion, so we'll review it today. The remainder of the meeting will focus on the SGP's consideration of quaternary ammonium compounds, or QACs, as potential priority chemicals. To inform our deliberations, we'll hear from 4 guest speakers: Bill Arnold of the University of Minnesota, Amina Salamova of Indiana University, Libin Zhu of University of Washington, and Keith Hostetler of Toxicology Regulatory Services. As usual, there will be time for questions from both the panel and the audience after each guest talk. After the presentations, the panel will formally deliberate on whether to recommend QACs as priority chemicals for the program for Biomonitoring California. And that session will include 3 parts: an overview of the potential priority chemical document, BioEHA, a public comment period, and then a discussion by panel members. And the final option of the day after the deliberation and discussion by the panel members is an open public comment period. So as I mentioned, after each presentation, there will be a question and answer period. So speakers should remain unmuted with their webcam showing so that they can respond to questions from the panel and the audience. If SGP members wish to speak or to ask a question, please just raise your hand, like physically raise your hand, and I will call on you at the appropriate time. And then at that moment, you can unmute yourself to ask your question or provide your comment. If webinar attendees have questions or comments during the periods after each talk, you have a few choices. You can submit them via the question feature of the GoToWebinar platform, or you can send an email to biomonitoring@oeha.ca.gov. That's biomonitoring@oeha.ca.gov. And just a reminder to please keep your comments brief and focused on the items that are under discussion. Relevant comments will be read aloud, paraphrasing if necessary. We can also receive oral comments from webinar attendees during the public comment periods and the afternoon discussion session. So if you wish to speak, please use the raise hand feature or the question feature in GoToWebinar, and they'll get that message to me and we'll call on you at the appropriate time. So I would like to start our first session by introducing Nerissa Wu. Nerissa is Acting Chief of the Environmental Health Investigations Branch at the California Department of Public Health. She's overall lead for Biomonitoring California, and she will provide us an update on current program activities and an overview of possible options for statewide surveillance.
Good morning, everybody. I hope you can hear me.
Yep.
Okay. Let me get over to my screen. There we go. All right. Sorry for the delay. No matter how many times I do this, it takes me a minute to figure out all the different buttons. Okay. So, welcome everyone and good morning. I'm going to give a brief update on various program activities, including the CARE study, AB 617 work, and then where we are in consideration of our surveillance options as a program. But before I get to staff updates, I do want to mention that Biomonitoring California is now a member in the National Biomonitoring Network. This is an effort led by APHL to provide guidance on standardization across the state programs. We always really learn a lot in interactions with programs from other states. So I'm looking forward to having another forum within which we can do so. We have had some changes to staff since our last meeting. We have 2 new lab people, Dinesh Adhikari at EHL and Jagdish Dhaliwal at ECL. We've also lost 1 person from ECL. Ting Jung has left her position. And we have a couple other staff changes, including Marley Zolay, who you know from this forum, who has left her position at OEHA, and Lauren Boehner, whom you have also heard from here, particularly about metals in the ACE project, who has left her position at EHIB. So welcome to new staff. We look forward to working with you, and big thanks to our departing staff for all of your contributions to the program. We have one other staff change which is not reflected on this slide. Dr. Kathleen Atfield has taken on a new role in biomonitoring. She will be the Chief of the Biomonitoring Investigations and Outreach Unit. So really looking forward to continued greatness from Kathleen. CDPH staff continue to be redirected to COVID-related work to a large extent. I think it's hard to appreciate what that means if you're not in a Department of Public Health. But within EHIB, about 80% of our staff have been redirected to some extent, meaning that either some percentage of your day is spent on COVID work, or you're rotating in and out of COVID positions. And then there's some people who are just working on COVID for months at a time. So all staff are impacted. If you yourself are not redirected, you are helping cover work for your colleagues who are redirected. And this is obviously our public health priority right now. It makes sense that we're working so much on COVID, but the impacts on our program and on our team and the work that we are trying to do here, the impact is significant. So it was a year ago that we had to make the call to shut down CARE 3 in San Diego and Orange counties. And we had gone through 2 rounds of participant selection in accordance with our sampling quotas. But given the short period of time that fieldwork was up and running, the breakdown of participants who were able to complete study participation did not reflect those quotas. The next few slides are just to give you a sense of who those participants were. We had hoped to reach 350 participants, but at the time we closed down, we had only collected samples from 90 of them. And if you remember, we were having some delays getting our Orange County office up and running due to difficulties finding short-term staff for those offices. And so as you see on this map, 84% of participants are from San Diego and only 16% are from Orange County. Because we had to end early, the participants who completed the study did not reflect the region by race, as you see here. The majority of participants were female, which is not unusual for a study like this, but almost all had more than a high school education, which is not reflective of the county or the region. Median age of participants was 53 years old, and 98% of the participants were internet participants, meaning that they completed their informed consent and their questionnaire, and they made their appointment online. Makes sense also because getting the paperwork back and forth through the mail took much longer, and so in the short time our offices were open in San Diego and Orange, we didn't have time really to have the paper participants get enrolled and in to give their samples. As for how participants found out about the study, 37% came from our randomized household postcards, 43% came from Craigslist, and the remainder came from community groups, family, friends, and etc. So these differences between CARE 3 and Region 3 will be important to remember and also consider when we have summary data to look at. And here's where we are with the CARE study. At our last meeting, we were on track to return results on schedule, meaning that this month we'd be sending packets out to our CARE 3 participants. But there have been some delays in getting lab results back. The labs are also not immune to the impacts of COVID. We have been able to call back our participants with elevated metals levels in our prescribed follow-up, and we hope to have those packets, the full results return packets, out to participants soon. And then a quick update of the AB 617 projects. Since our last presentation, the team has been working to identify a facility that would be appropriate for an air filtration intervention study. So they've been focusing on schools, we'll be looking at sites based on factors such as what is the local ambient pollutant levels, the type of filtration that they've installed, facility size, and the socio-demographic characteristics of those schools. So we're working with Cal to identify both biomarkers and air quality, air analytes to measure. We don't know when we'll be able to get out into the field, but the hope is that sometime by the end of the year, we'll be able to complete field work. In our next SGP meeting in July, we'll be focusing on biomarkers of effect, and so we will also feature a detailed update to the study. So what we're going to spend the rest of our time talking about is an update of where we are in our work to develop a new surveillance project. And I know we've talked about surveillance a lot. This is not to take away from intervention studies or community-focused studies. Are all valuable types of studies that are very informative, but our focus right now is trying to figure out how to continue with surveillance. And a few reminders of the context that we're working with, statewide mandate in our legislation, and surveillance is to be used to evaluate levels of chemicals in a representative sample of Californians to look at trends over time and also at the effectiveness of public health efforts and regulatory programs. And some of the characteristics of surveillance that we talked about last time, surveillance needs to be representative so that we can take that data and compare it across studies and across time. We want to be collecting data that's useful so that we can have an impact on public health. And the protocol needs to be acceptable so that people will actually enroll in the study and take part in it. The other thing is that surveillance really does need to be a stable protocol, something sustainable, so that we can implement it reliably across time so that we can see temporal trends. Now, of course, the dominant factor in our discussion is always our budget and the financial realities that the program faces. As we've discussed before, the program eventually has the same baseline budget that we've had since 2007 when we were founded, and this budget covers only staff. So no money in our budget for field expenses like contracts or supplies or rents or participant incentives. So one of the questions that came up in our last meeting was about how much does each study component cost? So what makes sense for us to try to save on when we design a new protocol? And this is a function not just of dollars, how much does something cost in dollars, but also of how the program can spend money. So our state mechanisms for how we pay for things in the state system, a process you go through for contracting or for bringing on temporary staff, and these present some challenges and barriers to us being able to move forward. So it's something we have to consider when we are looking at options for surveillance. The other cost that we really don't talk about a lot is the cost of staff time. So we have talked here about how the way we got CARE-LA and CARE-2 off the ground is that our staff were working in a way that was not really sustainable. And the effort it takes to conduct any study is really considerable, but particularly something like CARE, we're moving from region to region. So every time you go to a new region, you've got to scout out the region and understand it, make connections with stakeholders, conduct outreach, find venues for sample collection, and then you have to find staff to run your offices. So at the same time, your staff is also doing things like developing quotas, selecting participants, and then managing those participants through the system. So this is really resource intensive in terms of staff hours. And so if you have a protocol that takes a lot of staff hours, those staff can't be doing things like analyzing statistics and getting data out of the program. And that has been a challenge for the program. It's something that we have always struggled with. Somebody recently asked me, what would it take for us to get back into the field doing CARE the way we were, one region at a time? And just a rough estimate I came up with was that we'd really have to almost double our budget in order to get back to doing a sustainable CARE program. So that just gives you a little bit of a context of our budget. So the last time we talked about some of the factors that we would want to consider, and we heard about this in the overview in the introduction. Some of the things that I heard in our discussion were that the time trend is a priority. We want to really be able to look at exposure over time. While we might not be able to cover the entire state, it might be important to compare sectors like rural versus urban might be important. We heard that we should focus on things that make California unique, the border area, immigrant populations, pesticide usage, air pollution. We also heard that we should look for less expensive ways to biomonitor, for example, using samples that are already collected or to evaluate exposure through wastewater surveillance. Well, today I want to provide you an update of where we are in our consideration of these options. With the input that we got, we have narrowed this down to a few possible types of studies, either obtaining samples from an existing study or working with a program with good coverage of the state. So that could be a healthcare provider or some other blood collection program like genetic disease. Or we continue to do field work the way we have been doing, but really limit the geographic region that we're trying to cover. And at this point, we are still talking about conventional biomonitoring with blood and urine samples. We did note that there was interest in looking at wastewater surveillance, something that we would like to continue to learn about and consider maybe as a companion to biomonitoring or as a way to screen for emerging chemicals at some point. So just in brief, we did look at studies that might have banked samples. These are just some examples of those. All really excellent studies, but not really designed to reflect an underlying population. So in that way, not really a good match for surveillance. The other issue is that they are generally not ongoing into the future. So if we're looking at exposure in the present or in the future, these are not examples of sources of samples that might work out, but always willing to hear about other studies. If you have other ideas of studies we could look into, please let us know. So we'll be focusing on the other three alternatives from the last slide. And the scenarios I'm going to describe to you, this is very high level. These are just potential study designs. This is still very much a work in progress, just a report back on what our current thinking is. So the two big costs of studies that we've talked about are participant management and field work. So with that in mind, we've really focused on study designs that minimize those expenses. So the first example is the partnering with a high coverage healthcare provider. And with this, we could design a study that would cover the state, or a region or a really limited focused area, depending on the provider's coverage. And then we could select participants from the membership roles in accordance with our eligibility criteria. And we have talked about the potential of partnering with Kaiser, as we did for Project BEST. Kaiser has the broadest coverage across California, and we have experience with working with them. When we conducted BEST in 2013, this was the first collaboration of its type, and there were a lot of issues to work out. It was a very resource-intensive study, and this is not something we could support at this point in our program. But there have been many studies since then. Kaiser's research arm has really evolved since then, and we've started to have some discussions with staff about how this might work out. And it's been sufficiently promising that we do want to continue to learn about how this might work. So one of the benefits of working with Kaiser is that they have the ability to order lab work. The samples for research are part of their medical request menu. So your participants could just go to the Kaiser lab that they normally go to, and the protocol for collecting that sample would already be in the system as a standard operating procedure. The flip side of that is that the protocols are established, so the program would have no ability to change that protocol. So that's an element of control we would lose. Also for Kaiser collaborations, Kaiser staff really are the initial point of contact for participants. So that whole task of participant interface also takes place outside of the program, and it's a little bit of loss of control over that. The benefits of this kind of collaboration are really clear. It's a sampling frame for which we have the contact information. The potential participants are already in a relationship with Kaiser, and there's a potential to look at exposure data along with health outcome data, which would be great. And there's no need to set up a field office. However, in some ways, it's a huge advantage for our staff to not be charged with participant outreach and enrollment, but again, it is a little bit external to the program, so there would be some loss of control over how a study is conducted. And, you know, when we talk about surveillance into the future, being able to collect this data for years into the future, this would require an ongoing partnership with Kaiser or whichever healthcare provider we work with. And again, that is something that would not be totally within the control of the program. We do need to figure out what costs would look like. Presumably, we'd have to pay for some Kaiser time, staff time, and a per sample cost. So we're continuing to look into this to figure out how it compares with the cost of doing our own study and whether it's something that the program could afford. Another option that we're considering is a high coverage sample collection program like Genetic Disease Screening Program, GDSP. This is something we piloted in MAMOS, but this gives us an opportunity to do something a little different in that we could do random selection and again define that geographic area, whether we want it to be statewide or regional or in a smaller focused area, kind of a breadth versus depth argument. But we could work with GDSP to get demographic information, and in early talks with GDSP, we have indication that we would be able to get, if not exact addresses, we could get some blurred geocodes for where participants are coming from. And we'll have to think about what that means in terms of identifying things like drinking water source or air quality. Considerable benefits of this protocol, we would have the ability to do probabilistic sampling over whatever geographic area we chose. In this case, there would be no concern about participant rate or no participant enrollment or management to worry about, no field office. Another unique benefit of this type of study is that the cost of samples is lower than when you have actual participants signing up, but it's also a transaction within the state, which is easier for us to work with than contracting with outside vendors or hiring staff externally. The biobank does have samples from the past, and so it would be possible, for example, to do a PFAS temporal trend looking back in time and then moving forward as we collect samples into the future. The samples can also be used as a screen for emerging chemicals, which is interesting. We do know about some of the downsides of these samples. It's only serum. There is a contamination issue so that we wouldn't be able to measure. There are a number of chemicals we wouldn't be able to measure. And we have talked about how this is a subset of pregnant women in California, those who enroll in the state prenatal screening program. And then there is no exposure information or interaction with the participants themselves. Finally, we've talked about a model in which we would conduct participant recruitment and field work, much like we've done in the past for studies, but we really limit the scope to a particular geographic area. I think last time I mentioned Sacramento County is maybe an area where we could do urban, rural, and maybe some agricultural areas. Although based on cost, doing something in our immediate vicinity of our office, like in the Bay Area, would make sense logistically. The model could accommodate probabilistic sampling, or we could continue quota sampling as we've done for care. Adapting care to something that focuses on a narrow geographic area close to our office does reduce the cost of field work, but it doesn't eliminate it. So we still have to figure out a way to cover those costs. And if we were to conduct probability sampling, we could look at temporal trends for that focused area, but it would not give us an estimate for statewide exposure. Another challenge is that in order to do probabilistic sampling, we would need to get a sampling frame, a file of contact information for eligible individuals in our area. And this is actually a considerable expense and requires a lot of staff time to manage. There is participant selection and recruitment also. Studies like NHANES spend enormous effort on this component of a study. 60% of NHANES participants require 6 contacts before they sign up. So this would be a lot of participant management on the part of our staff. So you can see how these potential studies compare. There are benefits of each type, but there are also challenges of each type. So our continuing task is to further develop these protocols, get some more information about the cost so we can really hone in on this list. We anticipate that we will not be out in the field conducting surveillance work in the next fiscal year, but our hope is that by next summer we'll at least have a direction so that we can start developing a study protocol. And as always, we welcome your input and advice on this. So with that, I will end my talk and open it up to questions.
Thank you so much, Nerissa. We have 10 minutes here for questions from the panelists. And just a reminder of how we'll proceed. If panelists can restart their video and then just raise your hand, and I will keep an eye out and call on you. So we'll start with Vina.
Thank you so much, Nerissa, for that very informative presentation. My question was about the GDSP, and would there be the ability to return results to participants through that program?
No. Whenever you get samples from GDSP, you do not have participant IDs. There is linkage that can happen so that they can get us information. There are studies that link vital stats, for example, and newborn outcome data. So that is a possibility, but we don't actually get the participant identification. So there is no interaction directly with the source of the samples, with the participants.
Taking off on that point, thank you for that, Vina. You know, I know that's a hallmark of the biomonitoring programs under this, or the studies under this program. How have you thought through approaching that of not being able to do results return in that setting?
Well, so results return is one of the things that one of the real predicates of the program, and it's also part of our values, is right to know. So being able to return results and have a conversation about the significance of the results, I think it's really part of building community capacity and understanding of environmental health. So it's hard to give that up. However, we could do broader kind of education and outreach, not of a particular population. These are not your samples, but you know, we could still reach out to new mothers or pregnant women, or to a general audience of, you know, this is what we're finding in the pregnant population. I should say that the results return effort is not insignificant, and so there are benefits of not returning results, right? You know, that frees our staff up to do other things. The other thing is one of the issues we've had with doing non-targeted screening is it creates some issues with results return, and so having anonymous samples actually would free us up to do some of that work. But you know, it is a mixed. I do have mixed feelings about it, because I do feel very strongly that having this interaction and having this educational component of our studies is really important.
Thank you for those thoughts, Nerissa. It was really helpful. And one of the things I'm hearing you say is some of the options that it actually opens, like doing non-targeted screening and under current constraints, sort of maximizing staff time while recognizing that it's not the goal of the program. But it does accomplish, it potentially helps accomplish some other goals under a setting of constrained resource constraints. So anyway, I appreciate that sort of elaboration. Other questions from panelists? Yeah, Oliver.
So one of the problems in collections is, of course, having a person going to a doctor's office or somebody who's collecting the blood. There are alternatives like dried blood spots and dried plate spots, which would be sent by mail and then could be sent back. Is that the possibility that has been considered, or is that just so little material or so contaminated that it would be of no use to the program?
Well, sure. I mean, I think it would be great to have different media that are more, that are easier to collect. I think there is a question about the contamination. I think Jessica Nelson in our last forum from Minnesota was talking about, and they've recently put out data on how the dried blood spots they were collecting in their newborn program really had very poor correlation with the cord blood for a mercury study they were doing. And we want to look at that carefully and think about whether the blood spots really are a good representation of exposure. There is, of course, the potential for contamination. Even in a hospital setting, you have the blood spots are in all sorts of environments. But if they're coming from people's home, you don't have a whole lot of control over how that blood spot is taken. It's even a concern with urine samples, where you want to be really careful about how they're handled and managed and sent back to you. So I think it'd be interesting to look into, and actually I'd like to hear from our lab folks about what the method might look like, whether there'd be enough material for them to really do a lot of screening on those samples.
Any other panel members? Yeah, Jose, please.
I have a question about Care 3. So is the thought right now then to not resume Care 3 down the line?
I do not think we will be resuming Care 3. When we first shut down, when we thought it was not a long-term shutdown, there's a thought that maybe we would be able to pick up where we were. At this point, we would have to start completely over again because we're, a year out. We'd have to restart an office, restart with new participants. We just do not have the funding for that right now.
One hand, did you have your hand up? Yeah.
Just curiosity that I want to hear Nerissa's opinion, thoughts about if, multiple different studies or the ways to recruit the participants. I think seems like obviously some sample amounts, the volumes limited. So the one participant, the subject, we cannot measure every, the priority chemicals from the one subject. It has to be like this participants have to be measured for this, and this different participants have to be measured for the different chemicals. Do you have any thoughts on that, or is that a limitation, or do you think it's okay?
Sorry, if I understand your question correctly, you're asking for the genetic disease samples, if we don't have enough volume, could we just get like 2 pools of samples and do different analytes on them?
Right.
Yeah, I mean,
yeah.
I mean, that is one of the things about doing probabilistic sampling, that you are creating a generalizable set of data. So yeah, that would be possible if we had the funding to purchase 2 sets of samples. I think the limits are if we wanted to do POPs. If POPs were a priority of ours and we really wanted to do lipids, that is a possibility that we could have a set of samples set aside for that. But because it's serum and because there's this contamination issue, there are some analytes that we just won't be able to do even if we had the volume, metals in particular. And obviously all the urine metabolites we won't be able to do.
Vina.
Two questions. One is a topic that I know we've discussed numerous times on this panel, which is related to the NHANES program. But I thought I would just ask again, given there's, you know, a new administration, and just wondered if there's any opportunity to potentially partner with what NHANES is doing in California, or leverage any of their samples at all. It's like I said, I know we've talked about this before, and there's a lot of challenges there, but just thought I'd ask, given new federal context. And my second question is about the potential utility of other kinds of biological samples, like hair, teeth, and nails. And might there be any role for those kinds of samples that tend to be a lot easier to collect?
For the first question, I'll say that NHANES data for California, it is not a recent issue that it's difficult to get NHANES data for California. That's something that has been an issue for many administrations. So I don't think the new administration will have bearing on that. Although Jennifer chime in if you have anything else to say about NHANES. As far as other media, hair, nails, and teeth, I think they do suffer from some of the deposition issues, like how representative they are, like where in your hair do you take that sample, for example. So I think those methods are worth pursuing. I don't think it's the program's role necessarily to do that method development, but certainly once those methods are robust and demonstrated, would be something that we'd be interested in looking at.
I can chime in about the NHANES question. Can you hear me?
Yeah, thanks,
okay.
Trevor.
So NHANES is not designed to be representative of any state, so we can start there. They always include California. They usually include LA County, somewhere in LA County, but those samples are meant to be used nationally, so they're not representative of LA County either. They do a lot of their Hispanic sampling in LA and things like that. So that's one of the issues. The other is NHANES is notoriously private about where they're doing their samples, even though now I imagine an internet site that will identify each county where they're doing the sample in the country, because people can see the trailers. Those are two issues that have gone back since the beginning of NHANES. So they really have to do with their sample design and their high level of confidentiality.
Hello, Meg. This is Sarah. I just want to make sure everyone knew that was Jennifer Mann. Just remember to everyone who speaks to identify themselves and hopefully share your webcam if you're commenting. I actually wanted to chime in response to the hair, teeth question from Vina. We actually examined different media early in the program, and there are a number of issues with hair. There's contamination issues. We actually settled squarely on blood and urine, and urine is pretty easy to collect, in fact. At least that's been our experience overall. So I don't think that would be a positive development or a feasible path. As Nerissa said, though, we'll definitely keep our eyes on, you know, innovative methods development and keep that in mind.
Kathleen, did you have something?
Yeah, hi. This is Kathleen Atfield from CDPH. I just wanted to chime in on another aspect of the NHANES question, in that we've recently had the the CDC biomonitoring meeting across granted states, which doesn't include us now, but because everything is virtual, many other states are able to participate. And they really put a big focus on the difficulties, the complexities, and the expense of all the field work and sort of the very heavy side of surveillance that many states are now trying to do. A lot of states had started off with more community or local based sampling, and now many more are trying to do more representative statewide sampling. So they, in that meeting, had really recognized that a greater coordination and maybe cost sharing of resources at the, across states and nationally was something they wanted to look into. And that could really benefit us down the line, because there is a bit of every state starting from scratch. And so that's more resource and cost intensive, of course. So thanks for the question.
One final brief question before we move on to public comment. Forgive me, Nerissa, if you already explained this in your presentation and I missed it, but I know that Kaiser covers about 1/4 of the state's population, but I imagine it's not truly representative. But are there sufficient numbers to get a truly representative sample of participants from Kaiser's membership?
I actually am going to call on Jennifer Mann again for this because she has looked into the comparison between Kaiser's population and the underlying population. Jennifer?
Yes, this
there
is
you are.
Jennifer. Now I'm sharing my webcam. So, yeah, they actually.
Sorry, Jennifer, we can't hear you very clearly.
Because
There
my
we go.
headset, my microphone was not in the right place. Sorry about that. So Kaiser has done, it routinely does comparisons with the demographics of their population and the demographics of California plus other insured populations. So they have a lot of underlying data that would allow us to do a probability sample and then weight it properly to be reflective of the population, and they have plenty of members. The one thing that I'm not sure about is what the coverage is in different parts of California. So I imagine in the northeastern parts of California, there may be less coverage. So that's one area. But in the most populated areas of California, it has good coverage and is pretty reflective of the population. But as I said, that's not a deal breaker because they have all the information they need to do proper weighting.
Great, thank you for that, Jennifer. I want to, let's see, Jose has one final question. You know what, let's do, I want to move, can you hold on to that, Jose, because I want to make sure we get public comment in, and if we have remaining time, let's return to that. We have about 15 minutes allocated, a little bit less now for public comment, and I will just turn first to Elizabeth Martyr to find out if any comments have been received.
We do not have any comments yet, but we do have one hand raised in the audience.
Why don't we call on that person for the comment?
Okay, that is Jianwen Shea. I'm unmuting you now. You will need to unmute yourself as well. There you go.
Yes, I did. Can you hear me?
We can.
Yes. Jianwen She, biochemistry, section chief of biochemistry. I'd like to address and on Professor Finn's question about the dry blood spots. So generally consider like contamination might be a problem. We did some dry blood spots work with 50 microliter, that's equal to 1 blood spots. We did a PCB, PBD analysis. From this process, we learned contamination issue can be very well avoided or overcome. For example, you can measure the metabolite, which environmentally may not have the capability to convert the parent compound into the metabolite. That's one way. Secondly, like PCB, you know the 200 line congealers. Environmental have the dominant PCB, we call the indicator PCB, but in human bodies tend to be the coplanar PCB, which might not have like 77, 126, 169 is maybe more important for biomonitor program is coplanar PCB. There are a lot of, except the 77, 126, 169 is rarely found in the contaminations. So dioxin is another example. 2378 is the most toxic dioxins, 17 of them out of 210. So by monitoring the relevant to the biomonitor program congealers, you also can address contamination issues. Third approach, Nerissa already mentioned, like Minnesota. Basically, you try to team up with the genetic disease program, try to convince them to use the device. In this case, is the filter paper. Filter paper to collect dry blood spots. You can pre-wash, pre-clean up the filter paper, which can be mutually compatible between the two programs. Some laboratory already start, and I forgot that GE, which holder the manufacturer workman, they already start the clean up the filter paper. We collaborate with them also. So that's, I'm sure, try to overcome the challenge might be the worthwhile, and then I believe laboratory can get it done. Thank you.
Thanks very much. So just a note to panelists that we do have, following this public comment period, we still have 20 minutes for panel discussion and recommendations to the program about surveillance screening. So keep noting your thoughts. And I just want to check with Elizabeth if we have any more public comments.
We do have an additional, we have no comments or emails, but we do have an additional speaker, person who would like to speak, if I may unmute them.
Great.
Nancy Burmeyer, I am unmuting you, and you will need to unmute yourself, and you should be free to speak.
How's that work? Can you guys hear me?
Yes.
Excellent. Hi, everybody. Nancy Burmeyer with the Breast Cancer Prevention Partners. I'm sorry not to see you all in person. I always love coming to the meetings when able. This may have been a more appropriate comment for the end of the day, but I'm not sure what my schedule has in store for me. So I just wanted to let everyone know, first of all, how much we love the program, which I am frequently saying to all of you. But I'm also continuing to try to get more funding for the program. And Nancy Skinner, who is the senator for the area of the state where the program lives, is now the chair of the budget committee. So our focus right now is to try to urge Senator Skinner to make this a priority funding, a priority program for her to fund. And I think it would be super helpful if this body were to send a letter to her talking about the need for additional funding. And just FYI, the request that I have put in right now is for $2 million a year going forward from general funds. So fingers crossed, we're continuing to organize more folks in support. And I just wanted to let folks know that I'm working on that.
Thank you.
Thank you for the update, Nancy. In the past, the panel has coordinated at times on a letter, that's obviously separate from the program itself, to the heads of each of the organizations that oversee the program. And then we've left it up to individual panel members if they wish to, use that letter to advocate with their elected officials or anything, but I'm happy to hear other discussion if there's additional activities that people would like to take. Sorry, I just muted myself. Elizabeth, if there's, I just want to check for any more raised hands because we are still in the public comment period.
No raised hands, no comments, no questions.
Okay, in that case, thank you for those. And we can return to panel discussion and recommendations, any input that we have for the program about the additional work that they have done in the interim about options for statewide surveillance, following up on some of the discussions that we had at our last meeting, and directions that you would like to see the program go, or other ideas for that they could investigate. And I want to start with Jose, who had a question or a comment right before we went to public comment.
Yeah, good, thank you. So just following up on some of the surveillance options that Nerissa was mentioning, it kind of seems like the combination of Kaiser with the focused area surveillance may be some of the best sources of participants to reduce the costs and to maintain how representative the sample is. At least from the Kaiser side, yes, I guess we don't exactly know how much it's going to cost per participant or sample ultimately collected, but I could imagine it will be a lot less than having to run the study by itself. I think what Kaiser is just present in most parts of the state, and for some of those areas in which there's not that great of coverage, then that could be then switched over to focused area surveillance. So then kind of focusing on specific groups of concern. Could be a thought. I like the thought process that you have been going through and looking at the different options maybe for this.
Sorry, to clarify, if I understand you, you're recommending Kaiser in areas where their coverage is robust, and then in areas that are not well covered by Kaiser, we would do our own probabilistic surveillance in those areas?
Well, to the extent possible, because that is complex in itself, because there's going to be a lot of areas, and even if you are trying to recruit a small number of participants in some of the outlying areas of the state, that's still going to require a good amount of effort to do that. But I would say kind of reduce the scope of the focused area surveillance and maybe target certain areas in which you're trying to include participants of certain characteristics that would be underrepresented.
Mm-hmm. Thank you.
Jenny.
Hi, can you hear me? Can you hear me?
Yes, we can.
Okay, great. Sorry, I'm having some audio problems here. I guess of your options, I like the focused area surveillance the best, because given that we don't have a sudden influx of new resources, which of course would open up more possibilities. But I feel like it's better to do a focused area well, using quota sampling if necessary to be reflective of the area, than to try and do the whole state, which is, you know, bigger than many countries. So I guess for what it's worth, I feel like the focused area sampling, we have a chance at least to get a good snapshot of that focused area. And I think it's probably, given the limitations we've seen of the CARE studies, like the beginning of CARE San Diego, where we skew educated, skew white, skew older, I'm not sure that would be any worse than data that's not represented for other reasons. So I guess I would vote for the focused surveillance, perhaps using Kaiser or not. And then again, just continuing to explore existing samples. You've listed some there. I know there's probably others, but again, to get away from the extremely high cost of doing your own epidemiology and your own sampling and your own transport of the samples, and et cetera. Thank you.
I think something you said made me think about another point I wanted to make, which is that, you know, in this fairly lean time of the program, I also want to think about types of surveillance that might be modular, that we could start small and build onto. So, for example, if we start with one focused area, if the program does grow eventually, then we can add on to that and maybe have several focused areas, or, you know, to start growing our area of coverage. I would CARE actually started that way as well, thinking that we'll start with 1 per year and eventually we could grow to 2 or 3 regions per year, which didn't happen. So for whatever reason, I'm still optimistic that we will grow at some point. But I do like the thought of being like thinking ahead to these, how this might fit into a series of building blocks to a point where we have statewide coverage.
Go ahead, Jennifer.
Yeah, I don't know if you can hear me. I am unmuted on my end. Okay. So
It's
I just
quiet.
Where's your mic?
Same issue. Okay. So my comment is that I really want to emphasize the importance of taking a probability sample approach over quota sampling. The main issue is that with quota sampling, we have no idea, even if the demographics we know about are reflective of the underlying population, if everything is reflective of the underlying population. So that's where a probability sample is really important. And at the National Biomonitoring meeting that just took place, this is the approach that states are taking now and that they're really encouraging. So I just want to make a plea for doing probability sampling over quota sampling.
Jenny, go ahead.
I do acknowledge that probability sampling is the best way to extrapolate the data. One other point I forgot to add is that if we can't, if we need to narrow the scope, to perhaps narrow the scope in age, so that we're not trying to interpret body burden of lots of different ages at the same time. So perhaps focus on young adults, for example, and try to limit our sampling of a kind of a narrower age band in order to kind of increase our capacity to make predictions, at least about that age group, and look for trends as an idea.
I wanted to pick up on an element that was in Nerissa's presentation, which was about just in reflecting the input that we gave at the November meeting, where several of us, I think, emphasized the need for constructing studies so that you can make comparisons over time. And I know that I was one of those people, and partly it reflects my research, where I'm really trying to look at how things change over time, and it's so difficult because there are so few data sources that collect data that's consistent enough, where the populations are consistent or the methodology is consistent, the analytes measured are consistent, that we can make any of those comparisons. And I know there's lots of good uses of data that are snapshots in time, but I think there's a real need for the ability to make comparisons over time. I think I mentioned in our last meeting that the research that I've been involved with for the last few years, we're able to see the impact of, for example, just looking in the area of phthalate exposure, we're able to see some phthalate concentrations decreasing in the population at the same time as others are increasing, and it corresponds to when some category was listed by Prop 65. Several phthalates were listed Prop 65, and then other phthalates kind of came into use as substitutes. Excuse me. And we can't see that without comparable data over time, and that's using NHANES data. So that's data that's consistently collected over time. And I totally get that there are that it's a resource limitation issue right now, but I guess I just wanted to raise that point again, that if there are ways in doing like what Nerissa is talking about, of sort of a modular program that could be scaled up, if there's a way to really keep in the forefront the notion of collecting data that will be comparable in the future, even as you're not able to sample the whole state, and so there will be areas that are not sampled that you have no way of making comparisons with, and some of that's just unavoidable. But keeping the need for making time comparisons, or the value of making time comparisons, in the forefront as you design the more limited versions of studies that could be expanded with time and budget. Jose.
Yeah, I completely agree with you, Megan, about being able to compare trends over time. That's kind of one of some of the more important pieces that we're concerned about, right? So are these exposures getting worse or getting better for the ones that we're most concerned about? Just kind of touching back on some of the core issues, right, which is the budget ultimately. Have any of you done any analyses about if you want to pursue going down the Kaiser Permanente line, even though we still don't know what the cost may be, how far can we stretch the budget ultimately to with the current restrictions that there are if we were to do something focused, or is it possible for you to be able to do something more probability sampling using Kaiser throughout the whole state? It's really a consideration in the end of budget, right? So it could still be used Kaiser, but maybe there's not enough budget to include a large range of people, and then we can proceed saying something like Virginia was proposing, just focus it a little bit more within something that's still probability sampling within Kaiser or something like that. Have you gotten to do any of those budget considerations of what could be feasibly done with the budget?
The short answer is no. That's kind of our next step as we dig one layer down to try to think about feasibility. One thing I have thought about is one of the issues we struggle with in state is our funding is fairly inflexible, fiscal year bound, and there are only certain ways you can spend it. So that is a challenge with a group like Kaiser, where we have to have contracts and it's a long-term process between deciding you're going to do a study and having participants actually on the line. One of the advantages to something like genetic disease is that it's flexible. You don't have actual people on the hook that you're talking to, and so if we suddenly got money, we could say, let's go buy samples. With a study, once you get out in the field, you can't stop. You need to know ahead of time that you're going to have this funding and have no uncertainty about whether you'll be able to follow through into collection of samples and all that. So I haven't done a comparison of how much each of these costs and whether they're feasible yet. Like I said, that's kind of our next step. But I am thinking about kind of mechanism of how we get this stuff done. And one of the things that strikes me is that the Kaiser model might be much more difficult than a model where we're just buying samples essentially from genetic disease. So it's just another thing to consider.
And just a quick thought too. I mean, there's a lot of COVID surveillance happening. Have you thought about finding ways in which to link up to some of those screening methods as to be able to do some of the same things since they're collecting samples?
That is a good point. Actually, genetic disease is doing some COVID work, I believe, using their samples, kind of going the other way, using their samples for COVID surveillance. But yeah, that's a good thought, and something we've actually started to reach out a little bit within the department and see what other kinds of surveillance programs might be amenable to working with us. It is a little bit of a hard time to start asking sort of research questions with COVID because everyone is so focused on just getting a handle on COVID. But as things get under control a little better, I think that is a worthwhile direction to explore.
Vina, sorry, I didn't see your hand.
Thank you. Building a bit off of Jose's comment, I do think it would be really useful to kind of see a comparison of what each of these approaches can get the program kind of within the confines of the current budget. And from my perspective, each one of the proposed approaches has its own pros and cons, but it's it's worth sort of continuing down the road to look at each of them, and then kind of look at that comparison of what's the impact, you know, that you can get within the current budget, and what might it look like to have, you know, maybe a hybrid model. I think like what some other panel members commented on, like if you did Kaiser and some GDSP, or, you know, versus just one approach 100%. So I think that kind of comparison would be very helpful.
I agree. I think it's a good exercise for us to go through, just in case, I mean, there are extramural sources, or if our budget does expand, we do want to be ready and have some models in place and have thought through that question. So we are continuing, I mean, our intention is to continue with these 3 types of studies and continue to kind of cost them out in more of a generalized way, and continue kind of honing down the list, but also get a little more specificity in this table that I showed at the end, so that we really have a sense of what is possible.
Jenny.
Hi, I just wanted a quick follow-up question. You said you started to explore what other routine surveillance is going on, and I think that would be very useful to perhaps have more information, at least from my point of view, for like how many blood samples are collected and tested for lead in children, for example, in the state, STD sampling. I'm just thinking a lot of different sampling and surveillance that's done. Might be kind of interesting to see the whole suite of surveillance and kind of look at that as a whole, and if it's possible to partner. And I thought about blood lead specifically because, you know, it's collected in a fairly contaminant-free tube compared to some other out of the blood tubes. Thank you.
Any other thoughts or input you want to provide? Yes, Oliver.
Yeah, I was encouraged by the comments that I've heard about the dried blood spots. It was less negative than maybe we thought. So I would encourage the program to look more into it based on those comments, maybe do a small trial, or at least review the literature, talk to experts. That might be good.
Thanks.
Kathleen, did you have something to add?
I just wanted to add the comment that while we're talking about surveillance at this moment in time, that of course this doesn't encompass the entirety of what we're learning from biomonitoring in California. So I really take Jenny's point, and working with other programs, of course, that are already also collecting some biomonitoring types of data, but also our lab collaborations and the studies that they work with and how that reveals information about patterns in California. So, you know, that also will get folded into our surveillance work and understanding what is happening in California.
Jose.
I don't know if this is the right moment to ask or not. Well, it's kind of related to the funding piece. Is it now possible for more direct collaborations? I'm really talking about subcontracts ultimately between researchers and the program to be able just to fund some of the personnel time and just the costs of keeping the labs running, given that, you know, there's a lot of research happening and a lot of investigators may be interested in running and measuring a lot of the different compounds in some of their own studies. Is that a possibility at this point?
Yeah, I know Jean-Wen's listening, and hopefully June Sue as well, and can chime in on this. Both labs are engaged in collaborations with external researchers. They are asked often to provide services analyzing samples, and that can be anywhere from like really a broad collaboration where we are more involved with the actual sampling or interpretation, or a lab fee for service. So both labs, I think, are quite involved with that. It is, I mean, there are, I think, limits to how much that can support the program. One of the challenges is that, you know, some of the analytes that researchers are looking for, we cannot always guarantee a timeline turnaround and whether we'll have staff or equipment in place to do those analyses. I'm thinking of the phthalate methodology. We don't have an analyst now, and the machine is being used for something else. The lab suffers also from a lot of underfunding, and I'm sorry, I sound like a broken record because I would say this, but they don't have the ability to have things like preventative maintenance and duplication of instruments. So if one goes down, another one can be used, and we don't have cross training. So you have multiple staff who can run a particular analysis. So it's not a private lab. That's not how we run, and so it can be difficult for us to make those long-term commitments that are needed and a turnaround time that's needed for grant-funded research. But the labs do quite a bit of that when they can.
We have time for just one more question, comment, piece of input for the program before we move on to the topic of QACs for the rest of the day. So if you have any final thoughts about surveillance testing and things that you'd like the department to think about, now's the moment. Accepting, of course, that you can always send ideas to the program and they like receiving those.
We do.
Okay, if there's no more input from the panel, Nerissa, I want to thank you for this update, and thank you to the program also for running with you know, the notions, including incorporating some of the ideas that we discussed at the November meeting. And it's really nice to see the continued evolution of the program's thinking on this. So thank you for that. And we'll move on to the next part of the program.
All right. Thanks, everyone.
I want to introduce Shoba Iyer. She's the staff toxicologist, or a staff toxicologist, in the Safer Alternatives Assessment and Biomonitoring section at OEHA. And she's going to introduce our main topic for today, which is the consideration of the class Quaternary ammonium compounds, QACs, as a potential priority chemicals. So I'll turn it over to you, Shoba.
Okay, great. Let's see. Can you confirm for me that you can see my presentation in full screen mode?
Yes.
Okay, great. Thank you very much. Good morning, everyone. So in my presentation this morning, I'll provide an introduction on quaternary ammonium compounds being considered today by the SGP as potential priority chemicals. This is the first of multiple agenda items in today's meeting on this class of compounds. Later in the afternoon, I'll deliver a presentation highlighting some of the content that is covered in more detail in OEHA's potential priority chemical document. Here are the past SGP actions on quaternary ammonium compounds, or QACs. In March of 2019, the panel requested a preliminary screening of this class. In July of 2019, the panel reviewed OEHA's preliminary screening and recommended that we prepare a potential designated chemical document on QACs. In early March 2020, the panel considered QACs as potential designated chemicals and recommended that the class of QACs be added to the list of designated chemicals. And at that same meeting, the panel requested that OEHA prepare a potential priority chemical document on QACs. We've provided a PDF of this document to the panel members, and we posted a PDF of it on the Biomonitoring California website on the page for today's meeting. OEHA's previous 2 documents on QACs are also posted on this meeting page. The SGP can recommend priority chemicals for biomonitoring in California from the list of designated chemicals. The criteria for recommending priority chemicals are the degree of potential exposure, the likelihood of a chemical being a carcinogen or toxicant, the limits of laboratory detection, and other criteria that the panel may agree to. Note that these criteria are not joined by the term and the panel is not required to specify other criteria. The general chemical structure of QACs includes the cation NR4+. These compounds contain a nitrogen atom with 4 covalent bonds. The R groups are often, but not always, an alkyl chain or benzyl ring. These are the chemical structures of 3 QAC subclasses: benzyl alkyl dimethyl ammonium compounds, or BACs, dialkyl dimethyl ammonium compounds, or DADMACs, and alkyl trimethyl ammonium compounds, or ATMACs. And here are examples of QACs in each subclass. Benzyl hexadecyl dimethyl ammonium chloride is an example of a BAC. Didecyl dimethyl ammonium chloride is an example of a DADMAC. And hexadecyl trimethyl ammonium chloride is an example of an ATMAC. The alkyl chain length for these compounds is typically between 8 and 22 carbons long. Now, here are the chemical structures of selected QACs that do not belong to any of the 3 subclasses I just reviewed. There are a number of polymers with quaternary ammonium centers called polyquaternium compounds, shown here as an example, polyquaternium 42. Ester quats are another subclass of QACs in which the alkyl chains contain ester linkages. Cetylpyridinium chloride is an example of a QAC containing a pyridinium ring. And the herbicides diquat dibromide and paraquat dichloride are other types of QACs. QACs are used in a variety of applications, including as antimicrobials, preservatives, antistatic agents, softening agents, surfactants, and corrosion inhibitors. The class we're discussing today includes all types of QACs. I'm showing you here a picture collage of a variety of products and applications that QACs are used in. I talked about this topic more extensively in my preliminary screening presentation to the panel at the SGP meeting in July of 2019. QACs are used in some cleaning products, like disinfecting surface wipes and sprays. They're used in some antibacterial hand soaps, hair conditioners, other personal care products like hair care items, facial cleanser and body wash, lotions and mouthwash. They're used in some cosmetics. They're used in fabric conditioners or fabric softeners. They're used in some eye drops, topical antiseptics, and oral antiseptics, some clothing or textiles and shoes. They're used in some swimming pool algicides and used in oil and gas operations, which includes hydraulic fracturing. After our guest speakers' presentations and my afternoon presentation, the panel will have an opportunity to deliberate on QACs as potential priority chemicals. At that time, the options for the panel will be to recommend the class quaternary ammonium compounds, or QACs, be added to the list of priority chemicals, defer consideration of QACs, or decide against adding QACs as priority chemicals. This concludes my introductory presentation. I'm happy to take questions at this time.
So we have time now for clarifying questions before our next presentation, and they can come from either the panel or from the audience. Panel members, you can just raise your hand, and audience members will alert the organizers, who will alert me. Let's start with Tom.
Sorry, I had to find the unmute button. So you were showing all these different types, and I mean, you showed slides with the main compounds we considered, and then you showed alternatives which are related, and then you also discussed several uses. I just want to get a little clarity about when we talk about the class of quaternary ammonia compounds, how wide of a net will we be covering, or is that something we have to decide? If we're just going to say anything that someone would classify as a QAC is in the class, or is it only going to be like the ones on the first slide that are truly, you know, have the central nitrogen structure, and the common variations used primarily in disinfection products?
We're considering the whole class of QACs. This is what the panel voted to recommend adding to the designated list, and that's the class that we're considering as potential priority, or discussing as potential priority chemicals today. So I will point you to the preliminary screening document OEHA produced in 2019, and the potential designated chemicals document OEHA produced last year for some of the chemical structures and descriptions that describe the variety of the class.
So the QACs, that are we continuously finding new sources, or at this point do we know pretty much know what the main sources are?
My sense is that we're continuing to find new sources, and I say this because one of the new pieces of information that's been released in the last year is information that the government of Canada has produced. They were doing a collection of information on what QACs are used in their commerce, and the information they have now shared includes 800 QACs. And so for your reference, when I was initially looking up, you know, how many QACs can I find in this class, I located about 100. So they've received information on many more. So I would say that we're still learning a lot.
Oliver, did you have your hand up? Yes.
So you said, you know, because all QACs are concerned, and QACs are characterized by having tertiary ammonium cations, how do you restrict it to things that are industrial used and industrial produced, and not endogenous compounds like choline, carnitine, and so on, which are obviously, well, compounds that we have in our diet?
Yeah, I think that gets into more of a laboratory method discussion, and I don't know enough to know what would be captured in a single lab method. I'm not sure if there's another input you want to add in, Sarah?
Yeah, I was just going to chime in and say, yeah, basically, Shoba, I was going to say a similar thing. So the idea, Oliver, is we typically, nowadays, as you may recall, we tend to look at entire classes. Now, remember, there's no obligation that we monitor everything in a class. It's just the opportunity to choose whichever member of the class we wish to biomonitor. So any decisions about what's actually measured would obviously take those issues into account.
Okay.
Now, I will add that one of the topics that came up when you all voted for the entire class to be listed as designated chemicals was the option to potentially restrict it to a narrower set of chemicals. Ultimately, you decided against that. The panel voted unanimously to include the entire class and asked us to bring back the entire class but I just wanted to remind you of that discussion.
Thanks, Sarah. Elizabeth, are there questions from the audience?
There are no questions and no raised hands at this time.
Okay, other clarifying questions from the panel? I guess one thing that was a little bit on my mind, that's not quite a clarifying question, but just to raise from, based off of what Sarah just mentioned, is one of the things that I think the program has been responding to in moving toward designating chemical classes is the notion of sort of serial substitution, and also the variety of uses, and that certain categories, sort of subgroups of a class of chemicals are used in some applications and subgroups are used in other applications. And that in the past, as we've deliberated designations around potentially large and very inclusive classes like PFAS, that has been what's kind of raised to the fore, is that it, rather than endorsing that the department or that the program should monitor for so many members of a large class, that it gives them the flexibility to select the most relevant chemicals to monitor potentially as industrial uses shift or as new applications are encountered, and that kind of thing. So just sort of to pick up on what Sarah said, that was something that was on my mind. Any other questions for Shoba before we move on to the next presentation? Oliver.
Well, not knowing what the next presentations will tell us, do we have reasons to, or are there newer reports that focus on one or the other class of quaternary ammonium compounds with respect to accumulation, toxicity, and so on concerns? Is there any thing that we will hear? I mean, I don't know what we will hear, right? But something that maybe is known to the program but not yet detailed or so. If you understand what I'm trying to say here.
I think I'll point you to the potential priority and potential designated chemical documents we put together, and I think I'll ask you to sit tight, and we'll learn some information and have more opportunity for discussion on, I think, this point later today.
Okay.
Thanks, Shoba. Elizabeth, if there's any other questions from the audience we should tend to, and if not, we'll move on to our next presentation.
There are still not at this time.
Thanks so much for that. Thank you, Shoba. Let's move on to our next presentation. I want to introduce Bill Arnold, who is a professor at the University of Minnesota in the Department of Civil, Environmental, and Geoengineering. His research focuses on the fate of organic chemical pollutants, including industrial chemicals, pharmaceuticals, and pesticides in natural and engineered aquatic systems. And he'll present on environmental detection and degradation processes of QACs.
Thank you, Megan. I seem to have trouble sharing my screen at the moment. I have the little button.
We saw it for a moment.
Oh, wait.
There we go. Yeah. That's good.
Okay, got it. Yes, it was sharing. I didn't notice it. So, thank you. I'm Bill Arnold. I'm at the University of Minnesota in the Department of Civil, Environmental, and Geoengineering. It is winter, so we have some snow on the ground, unlike this sunny picture here. And I'm going to apologize up front. I have another commitment after the lunch break, so I won't return for those discussions. So if you have any questions about my talk, be sure to ask them when I'm done presenting here. So the work I'm going to present was not done by me. It was done by two of the researchers in my lab. My former postdoc, Sarah Patti, who did all of the environmental detection work and method development there. My former PhD student, Priya Hora, who did all of the experiments looking at the fate and degradation of the compounds under environmental conditions. Annika Heaps was an undergraduate in our lab, and all of our mass spectrometry work was done in the University of Minnesota Masonic Cancer Center facility. And the funding for this work came from the Minnesota Environmental and Natural Resources Trust Fund, which is how state lottery dollars are spent and invested in the state of Minnesota. So as Shoba explained, there are a large number of quaternary ammonium compounds, and she talked about the benzalkonium compounds, the dialkyl dimethyl ammonium compounds, and the alkyl trimethyl ammonium compounds, which are in various consumer products and other materials. There are also another set of compounds that we were interested in looking at, and these are the ionic liquids. And you'll see these have somewhat different structures in the quaternary ammonium group. Sometimes this compound is in the ring. And these molecules have been proposed as green solvents, as alternatives to volatile organic solvents like toluene or hexane or the like for use in chemical synthesis. There are also a wide variety of other compounds. So domophene is another disinfectant. This pyridinium compound with the C16 chain on it is actually in various mouthwashes. And our work with the QACs started in 2017 and 2018, and we were interested in finding out what was present in wastewater and in the environment, and for some of the reasons I'll describe later. But then when the pandemic hit, we realized that a lot of the compounds in the List N approved disinfectants from the US EPA for looking at coronaviruses or for disinfecting coronaviruses contained quaternary ammonium compounds. This little pie chart shows that over half of the disinfectants recommended contain either benzalkonium chlorides or dialkyl dimethyl ammonium chlorides or a combination thereof. So usage during the pandemic has almost certainly increased. So there are various routes of these compounds to the environment. So the ionic liquids are more likely to come from industrial settings if they're being used as these green solvents. Of course, they could also be used as cleaning agents in commercial buildings and the like as well. And then antiseptics and disinfectants might be more household type of usage. In our work, we did not look at the potential sources coming from agriculture, so the diquat and paraquat herbicides, although there may be some of these compounds used as surfactants or dispersants in agricultural settings. Once we get into the environment, there are various processes that can occur. These compounds are hydrolytically stable and they're non-volatile, so those processes aren't going to degrade quaternary ammonium compounds, but there was a previous review that suggested that removal by absorption to the sediments, biodegradation, and photolysis, or reaction mediated by sunlight, would be the major degradation processes in the environment. So we wanted to not only look at samples from potential inputs into the environment, specifically wastewater effluents, and then where they might wind up in the environment, which is the sediments, but also look at these degradation products to get an idea of the persistence of the QACs in aquatic systems. So just to give a quick overview of our workflow, we either took sediment samples or collected wastewater samples, and I'll give you the locations where we got those later. We do extract the QACs out of that matrix, and then we use a high-resolution liquid chromatography mass spectrometry system where the chromatography separates all the analytes, and the mass spectrometry allows us to detect individual analytes that we have standards for and even some that we don't. So for the wastewater effluents, we collected about 1 liter of water, and these were composited usually over a 24-hour period from the wastewater treatment plant. And we needed about 250 milliliters of this, and we would add some surrogates in there with isotopic labels so we'd be able to evaluate our extraction efficiencies through the process. We would extract this with a specific cartridge that does weak cation exchange to take molecules that have a positive charge on them, they stick to the matrix. We would then elute that with a formic acid acetonitrile mixture. evaporate all that solvent, and redissolve it in acetonitrile and some internal standards to assess the performance of the chromatography. So our method is a little unusual in the fact that it is a normal phase chromatography method, meaning that more hydrophobic and larger molecules come out first, and smaller molecules come out later in the analytical run. And we did this so we could see those ionic liquids, which are much more hydrophilic and much smaller, and wouldn't be retained in a reverse phase chromatography scenario where the hydrophobic compounds are retained much longer. We're actually trying to develop a reverse phase method as well, based on actually some of Amina's work that she'll talk about later, because it turns out that there are some advantages to having both operating. But essentially what this means is that when we inject our compounds into the system, the initial solvent going through the chromatograph is the organic solvent, so it's mostly acetonitrile. And over time, we take the gradient and make it more and more hydrophilic and add in water into the system. It's an ammonium acetate buffer and formic acid. And then as the compounds are eluted off, they're detected by the mass spectrometer. And because we're using a high resolution mass spectrometer, it looks at a wide range of masses with very high resolution to allow us to detect a whole bunch of different compounds. So overall, the workflow is somewhat I've described here as this extraction and then analysis, but the data on the back end is non-trivial. So if we're doing target screening, we have standards of the compounds we're interested in, and we calibrate the instrument to look for those. And so we can look at relative recoveries, we can subtract for blanks because we know what those compounds are. And blanks you do have to subtract for because these compounds are everywhere. And then we can get the actual concentrations in field samples. The other thing we're able to do, because we're using this high resolution mass spectrometer, is something called suspect screening, where we can look for masses that are indicative of compounds that we don't have standards for. So let's say we have a benzalkonium chloride where we don't have the standard for a specific carbon chain length, but we know the fragmentation and the parent ion mass. We can tell the mass spectrometer to look for those ions. And if we find those and the retention time makes sense, we get something called a suspect. And we do some calibration and blank subtraction there based on what we see in our blanks. Use the software to look for potential compounds. And then based on those suspect candidates and the calibration curves for other compounds that were in our target screening, we can get an estimated concentration of what's in these samples. So just to give you an overview of what we found in the wastewater effluents, these are the DADMAX. So the limit of quantification for these is on the higher end of our spectrum for our compounds, so between 50 and 130 nanograms per liter, depending on which compound we're looking at. The recoveries by the extraction method are relatively low. They tend to be about 15 to 20%. But we did see between 200 and 1500 nanograms per liter, and most of these compounds were above the limit of quantification. For the benzalkonium chloride, our limits of detection are much lower, 2 to 14 nanograms per liter. The recoveries were better than for the DADMAX, and the concentrations were somewhat lower than the tens to hundreds of nanograms per liter, with a couple of them reaching into the microgram per liter level. And again, in basically 3/4 to 90% of the samples, we saw the benzalkonium chlorides. And in the ATMAX, again, we have lower detection limits here, but much lower levels of detection overall, only in the tens of nanograms per liter in the wastewater effluents. Now, one other compound that we found, because we were screening for all these ionic liquids, was this specific one here. And note, this is not the C16 pyridinium compound that's used in mouthwashes. This is a C4 pyridinium compound. And the ionic liquids can be isomers of the benzalkonium chloride, so we were very careful to make sure that this is the pyridinium and it's not a small benzalkonium chloride. We saw this in a large number of samples. And if you have an idea of where this is coming from, I would love to know it, because we have not been able to figure it out yet. So just to give you an overall view of the compounds, we see the blue squares here are recoveries, so lower recoveries for the DADMAX, and higher recoveries for some of the ATMACs and the benzalkonium chlorides. And we did see domophene as well, and benzethonium, which are other quaternary compounds used as disinfectants. And, you know, between 20 and 90% of the time we see values above the limit of quantification of our analytical method. And if we look at the concentrations on the right-hand graph, we can see the DADMAX had the highest mean concentrations, followed by the BACs, and then this pyridinium compound. And most of the rest of them were less than 50 nanograms per liter in the effluents. So we know they're getting out into the environment from the effluents. The question now is how much is depositing in the sediments. So here we don't need much sediment at all, about 250 milligrams, and we extract it in an acidified methanol, and then take that extract and dilute it into water, and then basically treat it just like one of the water samples. It goes through the same cartridge, goes through the same extraction, and the same solvent exchange before we put it onto the mass spectrometer. Now here we did most of our work in Minnesota. I'll show first and also some data from California. In Minnesota, we did our work with sediment cores. And we collected these cores for a previous project looking at antibiotics. And this is 3 different sulfa drugs that were found in one of the sediment cores in Minnesota. So sulfamethoxazole and sulfapyridine are used by people, and sulfamethazine, I believe, is used by animals. And because the sulfa drugs were invented in about the 1930s, we don't see any of the compounds prior to 1930. Or very well, there's some contamination from the analytical process and the sample collection. But over time, as the usage of antibiotics increases, we can see an increasing usage in the sediment cores. And we wanted to see if these same patterns would occur for the quaternary ammonium compounds, because they also came into use in the 1930-ish time range. And so this is Lake Pepin, which is south of the Minneapolis-St. Paul area, southeast of the Twin Cities. And its watershed encompasses about 2/3 of the state of Minnesota. And so it's a great place to get an integrated look of what's happening across the state as particles move into the lake and are deposited in the sediment. You notice the sediment cores go back, they can be dated using lead-210 back to the 1880s. And we see concentrations basically nothing until about 1930 when QACs were brought into commerce. And then we see concentrations rise. And interestingly enough, we see a very large peak occurring about 1970, and then a decrease over time. And then we do see, especially in the benzalkonium chlorides here, kind of constant levels post-1990-ish. So this confused us for a little while, because this did not match kind of what we expected in terms of increasing usage over time of the compounds. And whenever this happens, you tell your student to go back and extract everything and do it again. And Sarah did it all again and got the same answer. So we asked the sediment core experts, and it turns out that if you look at metals in these lakes, they show a very similar trend. And so our hypothesis here is that what we're seeing is the effect of the Clean Water Act and the upgrade of wastewater treatment plants to secondary treatment and industrial source controls led to lower amounts of QACs making it out of wastewater treatment plants. And then what we're seeing now, post-1990, is more the steady state or slight increases in use over time. This is a place where we did suspect screening. So if I go back real quickly, you'll notice we have C12, C14, and C18 benzalkonium chloride here. This peak here matched the C16 back, which we did not have a standard for. And so we extract out the ions, and this 91 that's in the little red box here is really indicative of the benzalkonium chloride. It's the fragment of the molecule. And we can add suspect screening compounds, including the C8 and C10 DADMAX, which are used in lots of household disinfectants on the list end from the EPA, as well as the C16 back. And note that the pattern, there's some uncertainty obviously in the concentration, but the pattern matches pretty much with the other BACs. One thing I forgot to note here is this x-axis is an accumulation rate, so it's nanograms deposited per centimeter square per year. The concentrations of these sediments were tends to about 1,000 nanograms per gram, depending on the compound. So we also worked with the San Francisco Estuary Institute to take some samples. So when they were doing one of their sediment cruises, they took a suite of samples from across the San Francisco Bay Area for us to take a look at. And the lower South Bay, of course, is more heavily populated and has a lot of wastewater input, so we expected to see higher concentrations in the more southern portion versus kind of the more river-flushed areas in the north. And these were processed just like our sediment cores, except these were just grab samples at specific locations. And like we saw in the sediment core in Minnesota, we did see these are roughly north to south as you go from left to right. It's not perfect. But we do see the DADMAX and the benzalkonium chlorides, or the BACs, throughout the bay. Here, we're not able to do the accumulation rate of nanograms per centimeter squared per year because we don't have the right kind of data about the water body. But the concentrations, 10 to 100 or so nanograms per gram. So they are entering San Francisco Bay. We also had a sediment core that we collected previously in San Francisco. This is from the Central Bay area. The dates here are approximate because the St. Croix Watershed Experiment Station that we use here in Minnesota to do the dating of the core had trouble with this particular core, and so this is their best guess is kind of the dates. But overall, the trends largely make sense. There are lower levels deeper in the core where we think we're back in the 1930s, and higher levels of the BACs as we move into more modern times, into the 70s and the 90s. It's hard to assess whether or not there's any particular pattern like we saw in Minnesota in terms of an effect of the Clean Water Act, but that might much be harder to pick up in a system that has tidal influences and various other processes occurring, unlike Lake Pepin, which is really just impacted by humans. So the summary of our fieldwork here is we detect QACs in wastewater effluents up to the microgram per liter range for a few of the compounds. The DADMAX and the BACs are most frequent and at the highest levels. And we also see these compounds in the sediment. And so we know they're released into the environment, they're sticking to particles, they're depositing into the water sediments, but we want to know now what's happening in between and what processing might occur in the water column. So let's go back to our diagram here. And the processes we're going to investigate, or we did investigate, are photochemistry and biodegradation. So for those of you who aren't familiar with photolysis, this is the process by which light breaks down chemicals. So the compound has two pathways by which it can react. The first one is known as direct photolysis. And this is where the pollutant itself absorbs sunlight. So its absorbance spectrum has to overlap with that of sunlight and hit the surface of the earth. The other one is indirect photolysis, and this is where something else in the water column absorbs the light. So iron or nitrate or dissolved organic matter, and those compounds get photoexcited and generate a whole bunch of other excited species. So hydroxyl radicals, singlet oxygen, triple excited organic matter, superoxide, hydrogen peroxide. And this process is natural and it's very important in terms of carbon and elemental cycling in surface waters, but also it's important for control on pollutant levels in the environment as well. So for these experiments, we want to measure rate constants of the reactions with these specific reactive species that might form. So this is a plot that shows essentially the rate of loss of the quaternary ammonium compound versus the loss of a probe compound for hydroxyl radicals, which is perachlorobenzoic acid. And by comparing the rates of loss of the two compounds and knowing the rate of loss of the perachlorobenzoic acid, we can get the rate constants of the QACs with hydroxyl radical in this case, which is generated by a combination of UV light and hydrogen peroxide in a laboratory setting. So these reactions turn out to be essentially diffusion controlled with hydroxyl radicals. So they occur at the 10 to the 10th per molar per second, which you would initially think is great. These reactions occur very quickly, except that the hydroxyl radical concentrations in the environment are very low. So something on the order of 10 to the minus 17 moles per second. And so that gives us first order rate constant of approximately 10 to the minus 7 per second. And I'll convert that into other units on the next slide for you. So we did a whole suite of experiments to look for degradation processes. These compounds don't, with a couple of exceptions, benzethonium being one, don't absorb sunlight, and so they don't react by direct photolysis. And we didn't see any reaction with with singlet oxygen or triplet excited state organic matter, really showing that hydroxyl radical is the only kind of photoreactive, photogenerated species that was leading to degradation of the QACs in surface waters. And we proved this by looking at the degradation in some actual river water that we collected. And I'm just going to go through the upper right-hand plot here quickly. And the sunlight alone is the red squares, and that's just in distilled water. We see very slow loss over time, over 9 days or so. The blue circles labeled MRW are Mississippi River water. So these are QACs we dosed into the Mississippi River water. And the green triangles are the same Mississippi River water, but dosed with isopropyl alcohol. And the isopropyl alcohol quenches the hydroxyl radicals. And so the fact that we don't see any reaction when that's there really shows us that hydroxyl radicals are driving this photochemical loss. So if we take the combination of the concentration of hydroxyl radical in surface waters and the rate constant, the near surface rate constant for photolysis is about, the half-life is about 3 weeks. Meaning that half the compound will be gone after 3 weeks as it transits downstream or is within this water body, not accounting for any other sort of loss processes. And of course, that's just the near surface, and as light penetration is greatly impeded as you go to depth, if you integrate this over the whole depth of the water body, this half-life is going to become much longer. We also did biodegradation studies in river water, and here we took filtered river water just to get out the large particles, but we didn't filter sterilize it. And we dosed in environmentally relevant concentrations, so about 10 to 100 nanograms per liter of the C12 versions of the BAC, the DADMAC, and the ATMAC. And then we just kind of let them stir, exposed to oxygen, and monitored the QAC concentrations over time using LC-MS-MS, or the liquid chromatography mass spectrometry system. And we respiked these compounds 3 or 4 times over about the 2-month period. And we showed that degradation occurs over about 3 to 7 days. And with each time we dosed the compounds, we got faster degradation, suggesting there was some adaptation of the microbial community to the QACs. Now, of course, we were isolating these QACs, these bacteria from the environment. There were no other inputs of food over time from the initial river water. So the QACs might have been seen as more desirable food over time because we were putting them into the system and all the other carbon was being consumed. And we also did molecular analysis on these reactors, and we saw taxonomic shifts over time in the microbial community, showing decreased richness and evenness. So a smaller number of bacteria were becoming dominant over time. But we also did not see any evidence for antibiotic resistance changes in these microcosms, which would be expected because we were well below any kind of therapeutic or toxic dose. One other piece we looked at as part of this study was the formation of nitrosamines from quaternary ammonium compounds. This is because we were concerned that if the QACs got into the river water and then back into the drinking water treatment plant and were exposed to disinfectants, they might make nitrosamines, which I know are of great concern in California in terms of water reuse. And so we did this under something called uniform formation conditions, where they're exposed to chloramines for a certain period of time, and there's a residual of chlorine present throughout. We did this with analytical standards. We also purified the analytical standards by an extra step by putting them through the solid phase extraction cartridges we use for extracting the environmental samples. And this is because we were concerned that there might be some tertiary or secondary ammonium compounds where we didn't have the quaternary compound with the permanent charge. And those secondary and tertiary ammonium compounds shouldn't be retained by the solid phase extraction cartridge. And so those are known to be better NDMA precursors. We also use some commercial products and purified commercial products as well. to see if there was a difference between our analytical standards. And the total nitrosamine analysis will look for all nitrosamines, not just the dimethyl N-nitrosamine that's of greatest concern in Bill Metch's lab at Stanford. And the yields were relatively low. They were, 0.003 to 0.03% on a mass basis, which suggests there is some potential for nitrosamine formation from these compounds, but they're likely less important than many of the other known precursors of nitrosamines. So in the last couple of minutes here, I'll just talk about where we're going next with all of this. We have been archiving QAC samples in wastewater influence and effluents for about 8 months now to see what usage has been like during the pandemic. And of course, with the pandemic and lab personnel turnover and everything, we had to archive these, and we are just now getting ready to start processing the couple hundred samples we have stored in the refrigerator. And we're doing this both in Minnesota as well in the San Francisco Bay Area. We'll be looking at some stormwater samples for the San Francisco Estuary Institute. And another piece we'd like to do is some better spatial sampling and modeling. So actually putting in at a wastewater treatment plant, taking samples upstream near the effluent, and then floating along and taking samples over time to see how quickly the QACs dissipate along a stretch of river. Some potential issues we're interested in are effects on wastewater treatment operation. I've had discussions with some consultants where they've been concerned that issues they've been having in their activated sludge process might be affected by QACs. And there's actually a product called QuatBlock you can buy to remove QACs from your wastewater to prevent this from happening. And also potential effects on anaerobic digestion, especially during elevated usage during the pandemic. There are other questions we'd like to explore further. We wrote a little mini review about QACs in the COVID era. And there's good data on acute aquatic toxicology, but much less data about chronic effects for aquatic toxicology. And our back of the envelope calculation says that this would be a potential concern, whereas like acute aquatic effects almost certainly are not. There are some resistance issues to explore, and this is not my area of expertise, but this little diagram here is from Michael Gillings in Australia, who has shown that class 1 integrons, which are something that move, are mobile genetic elements, they have a QAC resistance gene associated with them. And the fact that there's QA resistance in the environment is not particularly surprising since we've been using these compounds for almost a century at this point. And again, I think there needs to be more work given the broad number of structures about nitrosamine, the potential for nitrosamine formation. And one other issue we're interested in exploring as well is improved treatment, because if we now know that these compounds are removed by settling to particles and by sunlight and by aerobic biodegradation processes, something like constructed wetland, if you have the land space, might give more time for these compounds to be degraded before they're discharged into receiving waters from wastewater treatment plants. And with that, I will let things go over to questions.
Great, thank you so much for that, Bill. We have 15 minutes now for questions from both the panelists and the audience. Panelists can go ahead and just raise your hand if you have a question. And we'll start with Tom, and I'll check in with Elizabeth in a few minutes about audience questions.
Okay. Thank you, Bill. That was a really interesting presentation. I think it gives us a lot of insight, especially about questions to ask. I'm curious about whether you or someone else has used the kind of information that you're gathering about deposition and transformation, degradation, to make some fate calculations of things such as overall persistence or the range of transport, long-range transport potential, and if you're aware of that, or if there's some ideas about who might do that.
We have not done that. That is on our agenda of things to do. We want to get a little more field data to see if we can match a model to the field experiments. And we've just started, we have a project pending with the state of Minnesota to do this kind of work for a broad range of antimicrobial chemicals. So not just QACs, but also antibiotics.
Right.
And so we've recruited a modeler to help with that. So I see that forthcoming, but we haven't done that yet.
Could I follow up? I mean, it's something we'd be interested in. I just want to suggest maybe that's, as I recall, we're dealing with hundreds of compounds, but often there's different kinds of screens, toxicity, but also persistence or fate. And it would help, I guess, ultimately be nice to sort these out by which ones are likely to persist the longest in an aquatic system or in the environment overall.
Yeah, and there's going to be I think the big driving factor on that is going to be the chain length of that carbon chain, right? So the longer that carbon chain, the more likely they are to be in the sediments. I think the rate constants for photolysis are all going to be very similar. And some of those short carbon chain compounds, which may not be at high use at this point and have different sources, are likely to transport much further.
Okay, thank you.
Unha, please.
It's very interesting work. I really enjoyed it. It's something that I was thinking like, oh, man, these compounds are really remind me of my work in nicotine. So much similar in terms of analysis, all the Hilliard column, all this kind of stuff. And then even oxidation and photolysis making nitrous amines as well. So it's very different compounds, but some kind of behaving possibly similar. And I was thinking about multiple things. What about this compound, this QACs, like depending on pH, how sensitive they are, to their behaviors depending on the pH? That's my first question. And the second question is how much we know about the nitrous amines? You showed some work, your work, and then is there any other studies that are finding that these compounds are transformed to nitrous amines in like more air or surface, non-aquatic environments?
Yeah, both good questions, Inha. The pH effects, my guess it's going to be relatively minor, just because these are already permanently positively charged, and most of them don't have another spot on them that's got any sort of acidic or basic functional group on them. And so pH might affect absorption. So certainly in terms of reaction or biodegradation, pH I think is going to be relatively unimportant because it's not going to affect their uptake or exposure. In terms of absorption, there might be some effect depending on if it affects the surface charge of what they're absorbing to. If what they're absorbing to is pretty organic, I don't think it's going to matter. But if it's a mineral surface, something like that, you might see some kind of pH effect. And there are some challenges with these compounds. We don't filter our samples through glass fiber filters, for example, because the QACs just stick to the glass fiber filters. In terms of nitrosamines, the real expert on that is Bill Mitch at Stanford. And I know he's looked at a large number of consumer products, both secondary, tertiary, and quaternary ammonium compounds and their nitrosamine formation potential. And then one of his former postdocs is one of my former students, Tung Zhang, who's now at Syracuse, and he's also done a fair amount of work with that as well.
Other questions from the panelists at this moment? Elizabeth, do we have anyone on the audience who wants to ask a question or make a comment?
We do. We have received a question via the GoToWebinar questions, and I can read that to you if you'd like. And we also have an audience member with a hand raised. So I defer to you, Megan, which way you'd like to go.
Why don't you start by reading the question and we'll give Bill a chance to respond to it, and then we'll go to the person with the hand raised.
Okay. Bill, I believe this is referring to something you presented on slide number 3. This is a question from David Jones. For the EPA list disinfectant pie graph, was the segment size based on number of registrations or on relative amounts of each product sold, like relative pounds or gallons?
Yeah, it's based on registrations. And so I just took the spreadsheet the EPA has and divided them up by which active ingredients they had. So I don't actually know how much is sold, although there was some trade information, and it's in our little mini review, and I think it was something like in the first 3 months of 2020, like more QACs were sold than all of 2019 or something like that. So, I mean, there was a massive increase in the amount used. But yes, it could be that a lot more bleach or some other product is being used than the QACs, but I'm not sure.
Jose, I see your hand. We had said we would unmute the participant who wanted to ask a question, and then I'll go to you next.
Okay, so Jun Soo Park with our DTSC, I've unmuted you. You'll need to unmute yourself.
Hello, this is Jun Soo from DTSC. Nice meeting you all. I have one key questions. First of all, thanks for sharing your interesting works and presentations. Based on your data, I'm particularly pointing out your depth profile for several QACs over time. They didn't quite show any more increase after 1980 cc year, the contrasting to the UCG. You mentioned the possible reason for that was the Clean Water Act enacted. I remember the resulting in having improved the wastewater treatment system. So you, at the last, your future work, you mentioned you want to measure QACs before and after the pandemic. That will be super interesting to see the result. But on the other hand, you know, based on your comment, we may not be seeing any dramatic innovation due to the pandemic, if what you said was true. So, but in contrast, we have seen some innovation changes in indoor environment and the human exposure due to the pandemic. What are your thoughts? You know, what are you expecting when you measure QACs in your sediment samples? Doesn't matter, it's Minnesota, lakes of Minnesota or San Francisco Bay Area. You know, I'd like to hear your thought. What kind of a trend will you be expecting before and after the pandemic? Thank you.
Okay.
It was nice meeting you.
Nice meeting you too. There's lots to unpack there. In terms of the indoor exposure and things like that, I'm going to leave that to the speakers after lunch because they're going to talk about that. And then I'm realizing that I should have shown one more slide from Minnesota, which I don't have in this presentation. And so Lake Pepin is interesting because a lot of the wastewater that winds up there, it captures everything that's municipal, but as well as everything that's industrial. Right, and so the QAC is used in all sorts of industrial cleaning and various other processes as well, not just surface cleaning for disinfection. We did another lake, it's called Lake Winona, and it only gets effluent from a wastewater treatment plant from a small town. And that lake, we saw basically continuous increase over time. So where it was purely a municipal input, we saw increasing loads. And, you know, its wastewater treatment plant came online about the same time. So there's multiple factors going there. And in terms of the pandemic, I expect that we'll see differences in the influence and effluence that we're measuring in terms of wastewater, you know, factors of 2 to 10 potentially, depending on how good we are analytically. But that also depends on if the activated sludge process, how well it adapted to the new levels of compounds that are in there and how efficient the absorption was. So it may be we see higher influent levels, but similar effluent levels, depending on how the wastewater treatment plants perform. And then the sediments, my guess is will be very hard to see any sort of trends just because sediments accumulate over time. And, you know, those slices often occupy, you know, anywhere from 2 to 5 to 10 years, depending on what the rate of deposition is in the lake, and even spatially in a river or in a river, there's so much movement of the sediment, we probably won't see any effect very quickly on the sediments. We'll have to wait 10 years and look for that peak when it deposits in the lake, but that'll give me the next proposal to write. So I move a little closer to retirement.
So I have Jose and then Unha.
There we go. Thanks for the presentation, Bill. Very interesting. Do you have a sense of what the half-lives of these may be in the water?
You know, back of the envelope, you know, if we take the biodegradation, you know, half-life to be about 3 or 4 days, and the photolysis one probably to be almost irrelevant in that, you know, we're talking days to weeks, depending on the light conditions and the nutrient conditions and all sorts of other factors in the water. And that's the degradation processes occurring in the water column. If you have a depositional zone where they're sticking to particles, you know, you could have really rapid removal. If your river flows into a lake, my guess is you get a lot of it removed just because all the suspended particles drop out in the lake, and then when they wind up in the sediment.
So they're not very stable under UV radiation, right?
No, they are stable under UV radiation. Sorry, let me rephrase that. Under sunlight irradiation, they're stable. We did not try hitting them with like 254, like the UV that's used for disinfection. But those doses are so small for DNA, you usually don't get much contaminant transformation when you're using UV for disinfection. Only when we had UV and hydrogen peroxide to generate the hydroxyl radicals did we get degradation. So that was more like an advanced oxidation process where you could get removal if you wanted to have that as a tertiary treatment step.
Well, okay. Thank you.
Unha.
Oh, Bill, just it's kind of curiosity, you know, some questions. You know, I really liked your study that you also had a targeted analytes and then you have a suspect screening put together. You might have already talked about it, but how many, what percentage of the analytes that you targeted in advance and then you sort of like added more, you know, the later?
Yeah, our initial target list, I think, was 26 compounds.
Mm-hmm.
And then our suspect list was, I think, another 25-ish or so, of which we saw about 12.
I see.
And some of those we've now added to our target list. So the C16 BAC, the C8, and the C10 DADMAC.
Mm-hmm.
And then there's a couple of ethyl, there's the benzalkonium chlorides with an ethyl group on them, on the ring.
Mm-hmm.
And those are used in a lot of compounds. And so it turns out standards for those are really hard to find. So we actually bought some products and we're going to run extract the actual products just so we can figure out where the peaks are, mm-hmm. so we can look for those.
Great.
Tom, go ahead.
Hi. One more quick question. I know we're going to break soon, but so you've been tracking movement in water systems, but are you aware of, or have you done any work about the relative volatility? I mean, what's the air-water partition? Are they going to be moving in air at all? Are these compounds, because of their ionization, essentially, I mean, are they essentially waterborne transport once they're released? I mean, that's where they're released. Is that where they go, or do they volatilize at all?
I think if in the environment, if they're in the water, they're going to stay in the water. Dust might be another ball of wax, right? So they do attach to particles. So my hypothesis would be that most air transport would be related to dust. So if you're using them on surfaces outside, or I think Amin is going to talk about indoor surfaces, that dust might be the air transport, but not the free chemicals themselves through air transport.
Right. Yeah, so basically the water to air transport would be very, very low.
Yeah, the permanent charge pretty much prevents that.
Okay, good. Thank you.
Great. We need to break for lunch. Thank you so much, Bill, for your contributions. And I want to, we're going to break for an hour for lunch. And before we do so, I want to introduce Christine Morioka, who is Senior Staff Counsel of OEHA, who will provide a reminder about the Bagley-Keene requirements before the lunch break. And as she gets on, I just want to say that we have an hour for lunch and everyone should please be back on the webinar no later than 1:10 so that we can start right at 1:15 as planned.
Hi there, this is just a reminder that this is a public meeting, and so we'd like you to refrain from conversing with each other during the lunch break and discussing the items that are on the agenda for today.
Thank you very much, and we'll adjourn for lunch and see you back at 1:10.